Selin Sayek Böke, welcome to the virtual media box. You're concerned about the use of artificial intelligence in medical terms. This is in fields like health monitoring, drug development, virtual health assistance, and so on. What are your fears? What worries you?
Indeed, first and foremost, I think you've already stated it, that it's very pervasive. We are experiencing AI throughout pretty much all aspects of healthcare and beyond healthcare, which requires that we think about the challenges that we face. The first challenge is clearly stated by the World Health Organization, is that we have heavy health inequalities right now, which have become that much more seen, if you wish, after COVID. And AI bears the risk of deepening these inequalities because AI itself includes parts that are driven by human decisions. We feed the data, we define the algorithm that it's going to work with, and the biases that might be inherent in the data or the algorithm could reproduce the already existing inequalities. Therefore, we clearly need, first and foremost, a framework that will ensure that these inequities do not reproduce themselves. The second risk that it bears is that it might replace the healthcare professionals and indeed get rid of the human aspect of a very critical human process when you think of healthcare services. And this could indeed reduce not only the number of skills that are existing, but also the quality of the skills that are inherent in the healthcare professionals and could erode the healthcare that we can access in the future. Therefore, we have to ensure that we keep the human aspect in the healthcare profession, even if we have AI as a complementary process. A third risk is that we have commercial capture of public health through AI. So this is our very private data that's being used in producing a very public good at the end of the day. And we have to ensure that the private aspect of the data is protected while producing the public good that could be generated for the larger benefit of the society. So we have to protect privacy, confidentiality of personal data. We need informed consent because we're sharing our very private data. And in this informed consent discussion, there is an issue about digital divide. Not everybody has equal access to digital processes. And indeed, not everybody has the same skills in reading the AI processes, if you wish. So we have to ensure that we overcome these barriers. And another issue is we have to define the liability of all stakeholders, because at the end of the day, the end user of AI is not only the health professionals, but also the patients, as well as the simple, ordinary individual throughout the day, the smartphones we use, the watches we put on, they all are data collection processes. So we have to ensure that the liability of each stakeholder in the process, from development to deployment and to the end use of it, is clearly defined. Otherwise, we might have a legal void, which could create a lot of negative externalities.
What sort of regulations would you like to see introduced in the member states of the Council of Europe that would actually help to protect privacy, prevent commercial companies from selling the information that they gather, and generally make it safer for the patients and for the medical professionals?
Indeed, the report puts forth quite an extensive list of recommendations. We do call out for the Committee of Ministers to indeed instigate a process through CAHAI, our ad hoc committee on artificial intelligence within the Council of Europe, to come up with a legal instrument, a convention maybe, a binding instrument, which would maybe be dedicated clearly to AI and would guide our member states and indeed have a global reach, if you wish, that goes beyond the Council of Europe. And a convention that would be open to non-member states as well, with an emphasis that we need a human rights angle to AI, because clearly all the risks that we discussed and the challenges have very critical implications on human rights. Therefore, we have to ensure that AI is not just seen as a technical issue, but we ensure that it protects the human rights. So one concrete legal instrument would be very useful in guiding member states. But beyond that, we also call out for our national parliaments of member states to have a holistic approach to the issue that again goes beyond this technical dimension of it and ensures that data privacy is well protected, We already have legal instruments for this within the Council of Europe as well, but also in the national member state level. We have to ensure that these data privacy legal instruments and frameworks are now in line with AI, which is very dynamic and fastly progressing. So we have to revisit the privacy laws that we have. And also we have to think about a certification process, if you wish, where indeed all stages of AI is certified and is screened through a sovereign perspective.
Selin Sayek Böke, thank you very much indeed.
Thank you.